Milia is again common presentation. When it's few in the face, usually it doesn't need any necessary investigation. While it's extensive, it can hide behind the multiple congenital syndromes that sometimes, or maybe acquired condition that sometimes we need to rule out. It's a form of sebaceous cyst or epidermal inclusion cysts. Affects about 40 to 50% of the newborn babies. And it can be few and can be covering the whole face, and usually affect the nose, forehead, and cheeks. Clinical sign that can help you to make the diagnosis. If you examine the mucous membrane, you will find these inclusion cysts on the mucous membrane of the mouth, which are called Epistian peels, or in the palate, which called Pons nodules. They usually heal spontaneously after a few weeks, and treatment usually not required. However, if you have an extensive milia, you need to rule some acquired secondary conditions and primary congenital conditions like familial profuse congenital milia. If you take a good history, you'll find that it runs in the families. Orofacial digital syndrome, which is I think is have about 10 types. Type 1 is the most common type when the baby presented with multiple facial and mouth defects, and usually X-linked inheritance. Bazin syndrome or Bazin syndrome is autosomal dominant syndrome where there's an extensive milia, loss of the finger prints and fingertips, blisters, and palmoplantar keratoderma. If you see milia, extensive milia later in the child, for example, after 1 year, you have always to think about, is there any underlying either genetic condition like epidermolysis bullosa or another condition like porphyria.